A 23-year-old man comes to the emergency department after falling on an outstretched right arm. He is in severe pain and there is erythema and edema over the right elbow. Neurologic examination shows diminished sensation over the palmar side of the fourth and fifth digits. Which of the following is the most likely location of this patient's injury? Choice A, near the neck of the humerus. Choice B, halfway down the shaft of the humerus. Choice C, distal humerus, proximal to medial and lateral condyles. Choice D, distal humerus, near the medial condyle. Choice E, hook of the hamate. Choice F, scaphoid. I'll wait 5 seconds and answer the question. So here's another one of those upper extremity nerve injury questions. These are very, very high yield. You want to know all of these? I am fairly confident that you'll get at least one, if not two or three, of questions on these exact injuries. So in this case, we have a sensory loss on the palmar aspect of the fourth and fifth digits, which suggests an ulnar nerve injury. And since the question also describes erythema and edema over the elbow, it suggests injury to the proximal arm rather than the distal arm, like at the wrist or something. So the ulnar nerve injury you want to know that is in the more proximal area of the arm or the humerus is a medial epicondylar fracture, which can injure the ulnar nerve that is traveling through the cubital tunnel. So choice D, distal humerus near the medial condyle is the correct answer. So in addition to the medial epicondylar fracture, you do want to be aware of cubital tunnel syndrome. USMLE sometimes likes testing on cubital tunnel syndrome and making you differentiate it from carpal tunnel syndrome because carpal tunnel syndrome is too easy. Everybody knows it. So let's look at some of the other answer choices here because they're pretty much all high yield, I would say. Choice A, near the neck of the humerus. This is describing a humeral neck fracture, which is most strongly associated with injury to the axillary nerve. Whenever you think of axillary nerve injury, I want you to be thinking deltoid, which of course would cause weakness in abduction of the arm. That's the high yield point, and it'll get you the majority of axillary nerve questions correct. Choice B, halfway down the shaft of the humerus. Obviously, this is talking about a mid-shaft humeral fracture, which you should know immediately is a radial nerve injury. Sometimes they actually make it even easier, and they'll say radial groove. So the obvious symptoms you would think of with a radial nerve injury are things like wrist drop, numbness over the back of the hand, weakness in supination, weakness extending the digits. I mean, it's basic stuff. You gotta know it. Choice C, distal humerus proximal to medial and lateral condyles. This is describing a supracondylar fracture, which you should associate with the median nerve. And of course, when we talk median nerve, we tend to think flexion at the wrist, flexion of the lateral fingers, the index finger and the middle finger, opposition of the thumb. And contrasting with this question, where the patient has lost sensation over the fourth and fifth digits, you would lose sensation over the palmar aspect of the lateral 3.5 digits, right? So it would be the thumb, the index finger, middle finger, and actually also the fourth digit as well. The fourth digit sensory is half median nerve and half ulnar nerve on the palmar side. Again, basic median nerve understanding. Choice E, hook of the hamate. A hook of hamate fracture can actually also injure the ulnar nerve that is within the Guyon canal. However, in this question, I went out of my way to tell you that there is erythema and edema at the elbow, so that suggests a more proximal injury. You would have similar symptoms of the fourth and fifth digits being numb, just obviously not symptoms at the elbow. Choice F, scaphoid. The testing point on scaphoid fractures usually isn't about nerve injuries. What they like testing on the scaphoid is avascular necrosis because of its very unique retrograde blood supply. So when you fracture your scaphoid, the proximal part of the scaphoid is subject to losing its blood supply and therefore going under necrosis if you don't treat it with a fixation or something. If you had to associate a nerve injury with the scaphoid fracture, it would probably be a median nerve injury, which again doesn't fit this question, right? So bring it back. You really gotta know these upper arm nerve injuries and fractures really, really well because they test on them all the time. And of course, I've made other videos about this already. But once again, humeral neck fracture, axillary nerve injury, damage to the deltoid and abduction of the arm, mid-shaft humeral fracture, injury to the radial groove and therefore the radial nerve. You'll get a wrist drop, difficulty with supination, difficulty extending the fingers, supracondylar fracture, median nerve injury. difficulty flexing the wrist, sensation on the palmar side of the first 3.5 digits. Medial epicondylar fracture and hook of hammock fracture both can injure the ulnar nerve at different places, one being the cubital tunnel and one being the Guillain Canal. And you might get stuff like this question where you have numbness over the palmar side of the fourth and fifth digits. Noties in and out. I hope you found this video helpful. I'll see you in the next one.